Good day to everyone. I am here Professor Dr. Malarvizhi K. Natarajan, NAPKIM, Vice President, Karnataka State Branch, in front of you presenting a condition where the patient will be having a stoma and how to take care of the patient with stoma. I really thank Ms. Rupinder Kaur, Associate Professor, and Dr. Manpreet Kaur, Professor and Vice Principal, a family of NAPKIM from SDRD College of Nursing for their generous contribution on this content which I am going to present today. Let us just move on to the stoma care part 2, how to change the colostomy bag. What are all the appliances required for changing the stoma bag? The amount of time a person can wear the appliance depends on the location of the stoma and on body structure. The usual wearing time is 5 to 7 days. The appliance is emptied every 4 to 6 hours. What are all the equipment required? Mild soap, clean clothes and towels, skin barriers like stoma adhesive, Convatec, cutting guide, appliance pouch. Optional equipments may be barrier powder, antifungal spray or the powder. Now coming on to the articles required for this change of stoma appliance. We have gathered that whatever we have mentioned and we are going on to the process of changing this stoma bag. First and foremost step, perform hand hygiene, which is required to avoid infection transfer. This prevents the spread of microorganisms entry, and hand hygiene with ABHR solution is mandatory. Gather the supplies or the equipments like flange, ostomy bag. Ostomy bag, you have the clip, you have the scissors, you have the stoma measuring guide, you have the waterproof pad, you have the pencil, you have the adhesive remover for skin, skin preparation, stoma adhesive, paste or powder, wet cloth, non-sterile gloves and additional clothes. The third step would be identify the patient who requires this appliance change and review the procedure. Encourage the patient to participate as much as possible or observe or assist patient as they complete the procedure. So, if it is the first time we do the procedure and show to the patient, if it is more than 2 times, the patient can be involved where we also help the patient, and if it is frequent changes, just assist the patient or observe whether they are following the proper steps of changing the appliance. So, proper identification complies with agency policy, and encouraging patients to participate helps them adjust to having an ostomy. Step number 4 is create privacy. Place waterproof pad under the pouch. The pad prevents the spilling of effluent on patient and the bed sheets, so that the bed is being protected from getting soiled. Step number 5, apply the gloves, remove the ostomy bag and measure and empty the contents. Place old pouching system in garbage bag. So, we can see here the ostomy bag is removed and it is being taken away from the body part, and you need to measure what is the content being collected in that and empty it into the garbage bag. If it is a changeable pouch, discard it so that we can replace with a new pouch. Step number 6, we have remove the flange by gently pulling it toward the stoma. Support the skin with your other hand, and adhesive remover may be used. So, you can just secure the other part of the stoma along with the skin, so that it does not get away from the position. support the skin with your other hand, non-dominant hand, and an adhesive remover may be used in order to secure it in place. Step number 7, clean the stoma gently by wiping with warm water. Do not use soap. So, this helps in aggressive cleaning can cause bleeding. So, avoid that aggressive cleaning, and if removing the stoma adhesive paste from skin, use a dry cloth first in order to remove the adhesive paste. Step number 8 is to assess the stoma and periostomal skin. The common problems the patients face is irritation in the skin, and there will be breakdown of the skin. So, assessment is more important. As healthcare professionals, we have to check how the stoma healthier or is it under damage. The stoma should be pink to red in color, raised above skin level and moist. Skin surrounding the stoma should be intact and free from wounds, rashes or skin breakdown. So, this is the picture which shows a healthy stoma which you are seeing on the screen. Step number 9, measure the stoma diameter using the measuring guide. Usually, if it is a ready-made product, the companies provide with a stoma diameter measuring guide, tracing the template and cut out of the stoma hole, so that it exactly fits into the opening. The opening should be 2 millimeters larger than the stoma size, so that it gets inserted properly without any damage to the stoma and to the adjacent skin. Trace the diameter of the measuring guide onto the flange and cut on outside of the pen marking. So, you mark with a pen, that is why the pen is used, and you just cut down with extra material, so that it rightly fixes into the stomal opening. Keep the measurement guide with the patient supplies for future use. Once you are guiding them or helping them, it can be a permanent one where they know this is the size of the stoma. Usually they can just take it every time they change the appliance. So, hand over to the patient with the supplies for future use. Step number 10, prepare the skin and apply accessory products as required or according to the agency policy. It may be due to agency policy where we follow certain steps, or it can be the company where it gives instruction based on the product which has been manufactured by that particular company, where they have their guidelines. So, accessory products may include stoma adhesive paste, stoma adhesive powder, or products used to create a skin sealant to adhere pouching system to skin to prevent leaking. So, certain companies have these special extra items along with the appliances given to the patient, so that they are very comfortable to keep the skin perfect healthy without having any leakage, and leading to breakdown of the skin is being totally prevented. Wet skin will prevent the flange from adhering to the skin. So, it is mandatory that if they are advising the company people with certain products, please support that, so that the process is going to be very comfortable for the patient. Step number 11, remove the inner packing on flange and apply the flange over the stoma. Leave the border tape on. Apply pressure. Hold in place for 1 minute to warm the flange to melt to patient's body. Then remove the outer border backing and press gently to create a seal. So, we can understand in step number 11 that the base backing flange is being adhered to the skin, and the methods are being explained very clearly, because the warmth what is within our hand, that enables the flange to just get stuck or get sealed, so that the prevention of leakage is being considered effectively. Step number 12 is apply the ostomy bag, attach the clip to the bottom of the bag. So, now it is very easy once it has been secured with the backing of the flange. Now, we take the ostomy bag, attach the clip to the bottom of the bag, so that it gets in contact with whatever the frame is there. This step prevents the effluent from soiling the patient or the patient's bed. Step number 13, hold palm of the hand over ostomy pouch for 2 minutes to assist with appliance adhering to the skin. So, we have to hold it to make it secure, thereby the flange is heat activated and it gets stuck to the backing flange, so that it is intact as a system. Step number 14, clean up the supplies and place patient in a comfortable position. Remove the garbage from the patient's room. Removing garbage helps decrease odor. Step number 15, perform hand hygiene. This minimizes the transmission of microorganisms from one patient to another. Document the procedure is the 16th step. Follow the agency policy for documentation. Document appearance of the stoma and periosteal skin and patient's ability to tolerate the procedure and assistance with procedure. These are all to be followed as per the manual given by the agency or the hospital policy. What would be the complications of this stoma care? Periosteal skin irritation, breakdown of the anastomosis, leakage of the effluent, paralytic ileus, that means the bowel is failing to move forward, obstruction of the ureters, wound infection, mucocutaneous separation, it is nothing but the skin background of the mucous membrane, stomal necrosis. Today we had just very well seen the procedure, how to change the ostomy bag appliance, very nicely explained step by step, so that initially the patients learn with us and we support them during the procedure in the second or third time, and as in future the patient becomes independent and confident in changing this bag on their own. Thank you very much for listening. If any doubts, please get back to us. We will be in a position to help you clarify your queries. Thank you. Have a good day.